Oh my God. I'm so sorry. Wait, hold on. No. I can't walk. Well, obviously it wasn't the fungus.
If your tax dollars at work, constantly building new roadways and bridges. Meningiomas, slow growing.
The cancer cells are actually regrowing a connection between the left and right hemispheres.
Oh, that is really good from the writers. You see, most people think that meningiomas, which are these lumps that grow from the layers around the brain, are benign. They're right. For the most part. Very excited to be reacting to House MD Season 5 Episode 24, Both Sides. Now, on this channel, we are reacting to all 177 House episodes, and this will be episode 114. Let's see if I can get the diagnosis before House does, as a doctor working in London.
I warned you against the snapper.
That guy is a bit of a blowhard, though. The food's not spicy at all. You can barely...
Mine's pretty spicy.
Have you been throwing rolls at me?
It wasn't me. It's not me. Bloody tear could just mean subconjunctival hemorrhage. House isn't gonna care.
The patient had his corpus callosum cut to correct a seizure issue, but he's having trouble adjusting to a split brain.
My left hand hates me. Alien hand syndrome.
Most people who have this operation don't even notice they're missing anything. Left brain has language, rationality, and right brain is a mute loser.
Right brain's also more aware of the present moment, our place in the universe.
We need to talk.
Begin eliminating. Search the home.
I'm your boss. You're an employee. People who get close to you get hurt. That's a fact.
I slept with Cuddy after she helped me detox from Vicodin.
How's the pain?
She's probably got some bruising.
Yeah, I get it. You're a stud.
She's probably got some bruising. Got some bruising! This man's faster than a surfing speedboat and at least twice as dry. Forget bruising, because did we forget our patient is bleeding from his eyes, loss of taste, scarlet tears, alien hand, all on the background of having part of his right brain removed. Starts with S, ends with Pisces. Oh yeah, it's spicy. So what could cause that? The episode is called Both Sides now, and I think it's describing the right versus left brain war the patient has, but also the fact that Cuddy is seeing House's personal and professional sides as well. I have a theory. This patient keeps talking about how it's not him who's doing all of these things with his left hand, but what if it isn't alien hand syndrome either? Maybe there's a parasite in his brain that's pulling the strings, which led to the seizures, loss of taste, and he's bleeding because he's not getting enough vitamin K absorbed from his gut as well. Cerebral echinococcus could technically do it, and he could pick it up from contaminated food or water. It would be tough to diagnose, but treatment would be relatively straightforward. That has to be my first diagnostic guess. Cerebral echinococcus. I'm surprised House didn't mention it, considering he's an infectious disease specialist and knows all too well the life of a coccus. Let's get more clues.
You were sober. She was sober?
Clean and sober and hot.
How are you gonna screw it up?
5 minutes ago, she told me that I'm just an employee.
Does our patient freak you out a little? If he's two people, then we're all two people and we just don't know it.
Is that fungus?
It's from the steam buildup.
You'd let your wife keep another man's offspring on ice next to the frozen peas just in case.
Did you know that male fruit flies have toxic chemicals in their seminal fluid that inhibit the sperm of other males?
I'm still trying too hard, huh? Trying to get your other half to like me.
Which means that it...
Antifungal meds? You should be feeling better in a few days.
Oh my God. I'm so sorry. Wait, hold on. No. I can't walk. Well, obviously it wasn't the fungus.
If your tax dollars at work, constantly building new roadways and bridges. Meningiomas, slow growing.
The cancer cells are actually regrowing a connection between the left and right hemispheres.
Oh, that is really good from the writers. You see, most people think that meningiomas, which are these lumps that grow from the layers around the brain, are benign. They're right. For the most part, but in just over 1% of cases, those meningiomas are actually cancerous. The team now think that the cancer is rebuilding the connection between his two brain lobes, causing his balance centers to go off. If that's the case, then good riddance to the other half of him, since I felt that pain with all my organs when he hit her. That other him is one crunchy-necked, smooth-brained invertebrate crustacean. Why can't his brain hemispheres talk to each other though? Well, the corpus callosum is the part of the brain that connects the two hemispheres, and he had to have it removed to fix his seizures, but when that happens in real life, what actually happens? In all fairness, the results could vary. For some patients, it can cause intellectual disabilities, poor speech, and problems with socializing. For one patient though, it turned him into a split brained savant. His name is Kim Peek, and he was born with no corpus callosum. He's been called the real Rain Man as his memory is what inspired the movie. His father mentioned that Kim was able to memorize information from just 16 months old, reading books, memorizing them, then putting them upside down on his shelf to show he'd finished reading them. Even as a child, he could get through a whole book in an hour, being able to read 2 pages at the same time using each of his hemispheres. One article with the Times claimed he could recall the contents of over 12,000 books. It wasn't all sunshine and roses though, as his difficulties with verbal subtests led him to have an overall IQ of 87, which I believe to be a very poor reflection of his phenomenal cognitive power. Where's a genie when you need one?
Phenomenal cosmic power!
Maybe our patient does have a hidden lesion in his head, but it isn't actually a cancer. Maybe it's a granuloma from autoimmune conditions or tuberculosis. Is it a parasitic ball like I mentioned and it's causing inflammation and reconnection because it's activating the immune system? So many possibilities, so little time. I mean, here I really wouldn't be surprised if there's some infidelity involved in the wife. It's clear she's not feeling loved, and being intimate can't be much fun when you never know what route things will take. Let's get more clues.
If you're right, the two halves have begun sending messages again. We can test for it.
Note how many more heated areas appear after less than a minute with me.
So it's either love or possibly rage.
Keep your eyes focused on the plus sign. Any image that appears on your far right will only be seen by your left brain.
Book.
Could you draw a picture of what you think the word might be?
This is so cool.
Yeah, that's not freaky at all.
It is cold. Why are you scratching?
Itches.
Ammonia breath. The liver is failing. I want permission to do a liver biopsy. We're looking for sarcoidosis.
Asking my permission is essentially wasting my time, and your reaction to that will be?
Yes.
Still not angry. Try again later.
Sorry, I know I'm a little ripe. Just a sweaty guy.
Recently?
Always. Sometimes I fantasize about cutting it off. Can you get music into this room?
I love how House will use all the sneaky schemes, investigations, and technology in the world to simply avoid having a normal human conversation. Such a complex character. Our patient isn't quite so simple himself, as we know he's been sweaty, his liver's failing, and all while he's the only person in history that has fantasized about starring in a Saw movie. All this talk of sweat though has gotten my brain juices flowing, as I have a theory. The episode title is called Both Sides now, and you know what else is split into two? His scrotum. Stay with me. You see, the excessive sweating as well as his previous seizures and now balance issues could be to do with his thyroid being overactive. If it was that simple, then they'd just pick it up on a blood test or see a swollen neck. But what if the source is hiding out of plain sight where the sun don't shine? A germ cell testicular cancer producing the hormone HCG. It's the pregnancy hormone, but it can mimic the one that stimulates the thyroid, causing his metabolism to speed up with a mind of its own. If you did a pregnancy test on him, it'd be positive, and that fits so well since it already seems like he's carrying another person on board. So paraneoplastic germ cell tumor has to be my second diagnostic guess. Question for you smart people, do you check your testicles or breasts regularly for lumps? What's your routine for doing it? When and where? Answers down below.
I think you're using your relationship with Cuddy as a replacement for drugs. You have to wait for her to be ready.
You're dying to know what I found on her coffee cup.
No.
Oxytocin. I need to make her lose her temper.
Dr. Cuddy asked me to come up here from the clinic. She says you're seeing patients in your office. I squawk like a parrot. Caw! Tough to fake that.
Points to a clotting issue.
The heart's fine.
He apologized for being sweaty, said it had always been an issue, but what if it's a symptom?
Pancreatic cancer. Let's scan his pancreas.
Here's my poo. Dr. House said to bring it over and leave it with you as soon as I could.
Where you going? Annie called. She's not coming back.
Great.
You walk out of here.
Stop!
She's just tired of being insulted by a limb. You want to go naked. Your right brain knows you need to stay. My right brain's an ass.
Just say the magic words. I will destroy my husband's sperm.
But I don't expect my condo to burn down by a fire insurance.
Your condo rules don't let you buy insurance. Did you go homeless?
Scan's clean. It's not pancreatic cancer.
If the cancer's too small to find, let's open him up and paint it. Scorpion toxin and infrared paint.
I got the forms to destroy the sperm.
No sign of cancer. BP's 90/60.
Does she look angry?
If you're standing there when she looks up here.
Oh no. Clots aren't from cancer, coming from his heart. Intermittent arrhythmia. Do a transesophageal echo. Start with the left atrial appendage.
Wow.
Then all we have to do is find out what damaged his heart before it goes after something he really needs.
Did House just figure out the team were looking in the wrong place because Cuddy was on the ground floor while he was on the balcony? Give that writer a raise, Universal. The parallels are Michelin star level spicy. Interesting though that the team were toying with the idea of clots and now they've found one in the patient's heart. It's no coincidence that Cameron and Chase's hearts are doing a bit of sticking together themselves. So what can cause our patient's clot in the heart and balance disturbance? If a clot went up to the brain, then that could do it, but it doesn't seem like they found one when they scanned his head. We also know he's been sweating and has these intermittent arrhythmias, which, to be honest, still fits quite well with my high thyroid hormone theory, especially if it was coming from a testicular cancer. It also fits the analogy of down below, looking above, and then House being above, needing to look back down below all along. Surely that will be the next epiphany moment. It fits so well. By the way, what on earth was House talking about with the scorpion sting pancreatic cancer diagnostic method? It's called tumor paint, and it allows us to label cancer cells, causing them to glow. That means easily being able to tell the difference between tumor and healthy cells when looking directly. The specific scorpion that makes the venom is called the Death Stalker, as it contains a chemical called chlorotoxin, which does the binding. This tech was promising back in around 2014, but sadly hasn't been approved and exists only in research. Who knew scorpion venom could have some dangers? If this was my patient, I would want to take a look at his scrotum next to see if the answer is hidden within its wrinkly walls, but I suspect it would need a lot of explanation first, so let's get more clues.
So what damages a healthy 20-year-old heart enough to make it send out clots like it's bombing Dresden?
Cushing's. Cortisol overproduction can interfere with heart rhythm.
Run a dexamethasone suppression test.
Ever since I've known Scott, I've seen his left hand throw thing, but always sort of playfully. When he threw this, it was angry.
It's special heavy-duty stuff. I have to send away for it. Somebody's grateful?
You don't have doubts. You just don't want to kill the only thing left of someone you loved.
I do have trouble giving things up. I never cancel any of our wedding plans.
I have an announcement. I slept with Lisa Cuddy.
This is beyond asshood. That is zero tolerance. So congratulations, House. I am angry.
I was wondering if we should move in together.
You're fired.
I think she likes you.
As you move your belt.
Makes me sore.
It's not a pot belly. It's a tumor.
The deodorant has a high proportion of propylene glycols. Our patient may never have needed split brain surgery.
I am overreacting. You've said plenty of lousy things to me before. You insulted me. I walked out.
That's not what happened. You helped me.
Are you okay?
So, this is the story you made up about who you are.
Too bad it isn't true.
I'm not okay.
So that's how House ended up in rehab. Love the twist they put in there. They were showing us what living in an alternate reality could be like. It all makes sense now. I can't believe how much context I'd missed by seeing the requested episodes before watching the earlier ones. Also, seems like our patient had propylene glycol toxicity, which the team said caused his seizures in the first place, meaning he never needed the surgery which split up his brain. Testicular cancer would have been such a more interesting diagnosis, especially with all the themes about Cameron not wanting to give up her ex-husband's sperm. Propylene glycol though is actually very safe and is even present in coffee drinks, ice cream and whipped dairy products. I think Taub meant to say it was ethylene glycol, which is in antifreeze and can cause a buildup of toxic compounds as the body breaks it down. Absorbing enough can even leave no hemispheres alive. This episode was heavy on the story and not so much on the diagnosis, but as expected for a season finale. I'd say 8.4 out of 10 entertainment, 5.5 out of 10 diagnosis, and 6.1 out of 10 accuracy. This episode doesn't make full sense until you watch a previous one where a professional ballet dancer is forced off stage.